Type 1 diabetes is a genetic chronic condition in which the pancreas produces little to no insulin. It is often diagnosed during childhood or adolescence, but can cause numerous complications and health risks throughout a patient's life. However, before we dive into the health risks and complications of type 1 diabetes, let's recap what we already know about healthy people and type 1 diabetics. The healthy glucose content of a person is typically 90 mg milligrams over 100 ml milliliters. However, those with type 1 diabetes can often suffer hyperglycemia and hypoglycemia. Let's define these two terms. Hyper, high, glucose, emia, presence in blood. High glucose presence in blood. Hypo, low, glucose, emia, presence in blood. Low glucose presence in blood. These two symptoms of type 1 diabetes can lead to numerous life-threatening health complications and risks. Number 1. Frequent thirst and urination. As water follows solute, water will follow glucose out of our bodies if there is too much of it. Brought on by hyperglycemia, the massive amounts of sugar is filtered through the kidneys and sent as waste to the bladder. Since water follows solute, it travels with glucose out of the body as urine, leaving little water inside the body. This triggers the brain to tell us that we are thirsty. However, the more water we consume, the more it will follow glucose out of the body, causing more urination. Number 2. Diabetic neuropathy. Neuropathy is defined as weakness and numbness from nerve damage, typically in the hands and feet. Diabetics often suffer from this as prolonged elevated glucose levels damage nerves. This complication can result in amputation of appendages that simply cannot function due to the loss of these nerves. Number 3. Diabetic nephropathy. This is damage caused to the kidneys due to hyperglycemia. Much like diabetic neuropathy, the tiny blood vessels are damaged by high glucose levels, and the kidneys simply cannot function and can go into kidney failure. Number 4. Diabetic retinopathy. Much like diabetic nephropathy and diabetic neuropathy, high blood sugar levels can damage the tiny blood vessels in our retinas and can cause them to swell and leak. Number 5. Weight loss. As type 1 diabetics can't produce insulin to allow glucose into cells and therefore create energy, their bodies begin to take it from other energy sources, such as fats. This massive breakdown of fat into energy can cause weight loss in numerous patients. These complications and health risks are some of the few of the things that type 1 diabetics must live with on a daily basis and control in order to keep themselves healthy and well balanced.